Hello, everyone. Welcome to my channel. My name is Jacqueline Lovett. I'm a licensed agent in over 20 states, and I help people maximize their insurance benefits. Today's topic we're going to be discussing is third party billing, your explanation of benefits, and the difference between that and an actual bill. So, I hear this from my clients all the time. I've been receiving bills from my doctor's office, and I'm trying to figure out why I'm getting these bills. I mean, I have Medicaid, so why is it that I'm receiving these bills? Well, it could very well be that your company or the doctor's office that you're going to is using a third party billing company, another company outside of the actual doctor's office that handles the billing for that particular doctor. They use a certain set of billing codes, medical billing codes, and they bill based on what that doctor actually does in those appointments or doctor's office visits. So when you're going to a doctor's office, um, and you're trying to figure out exactly what your copay is going to be or what your coinsurance is going to be, they usually will use the billing codes to send over to Medicare or to Medicaid or to your insurance company to let them know what was actually done and what would actually be billed for. So, depending on what you do, if it's a primary care doctor's office visit, for example, on most plans, that's usually a zero cost. Or if you go to see a specialist, for example, maybe like a gastroenterologist or your heart doctor, cardiologist, they may bill you a different copay because it's a specialist. Then you also will have different copays or coinsurance if you are going to be staying in the hospital. But you always want to check your summary of benefits. So the summary of benefits is actually the contract between yourself and the insurance company. So it tells you what your copays are going to be, what your coinsurance is going to be for every single thing that is associated with your insurance policy. And this is for health insurance. So if you want to know exactly what it is that you're being billed for, or you want to know what things are covered under your plan, you want to go to your summary of benefits. And you can actually access that by going on to your company's website. You can go to, AetnaMedicare.com for an example, or you can go to UnitedHealthcare.com or UHC.com to pull up this information. You usually would just need to put in your zip code along with maybe a county of where you live. And then you need to know the name of the plan that you actually are enrolled in. And usually that's going to be on your member ID card. If you don't have a copy of that, then you definitely want to reach out to your insurance company and let them know that you don't have your ID cards. Many companies now will just automatically send you your ID card through your email. So you may not even have a physical copy. You can just go ahead and add it to your Apple Wallet, and you'll be able to utilize your membership ID card that way. But if you don't have a copy of it, you can always call member services for your insurance company and they can actually just mail you out a copy of it. But you always want to reach out to customer service if you need a paper copy of your summary of benefits. I mean, most companies, they're not going to send it out to you unless you request it. They used to back in the day, but not anymore. Everything is online. So if you're going to need, information about your plan and you're curious as to what it covers, you can go onto the website and of your company's, your insurance company's website and pull that information, or you can always go on to Medicare.gov and you can put in your zip code there. It'll give you a list of all of the companies and their plans in your particular area. And you can choose the plan that is yours, the one that you have. And then you can pull up the summary of benefits. You can also access the evidence of coverage, which gives you more detailed information about your insurance plan, what it covers, what it does not cover, and also, a more deeper and more detailed itemization of all of the things that are covered under your plan. So basically, what you can and cannot do utilizing your plan. So whenever you get bills from a doctor's office or a hospital, the first thing I always recommend my clients do is to, number one, look over it and see if it actually says EOB, which stands for explanation of benefits, because it could actually just be a listing of what the insurance company paid for you on your behalf. And it usually will say something similar to, this is what the insurance company paid, and this is what you pay or what you owe. In many cases, you'll notice that they'll give you a large number for what the insurance company actually paid, and then a really really small number for what you owe. In many cases, you may not even owe anything, but it's always good to keep your bills, because just in case there's some improper billing codes put in, or you were billed for something that you didn't do. You can always keep those bills and go back to that third party billing company, or go back to Medicare, or go back to Medicaid, and submit that information. So that way you don't end up having to pay any medical bills unnecessarily. So those are definitely things I would check for. And I always tell my clients, if you get a bill in the mail, the first thing you want to do is find out, exactly how they billed it, what were the billing codes. If they billed you for a specialist visit when you actually went to just do your regular checkup, those are definitely things you want to discuss with your doctor's office as soon as possible, so that way you can get that rectified. Um, because doctors' offices and hospitals, their billing departments, they make mistakes too. So I always suggest doing that. Also, too, it's always important to make sure that you know exactly what is covered under your plan, what copays you're going to pay. So that way, if you do receive a bill, you already know what to expect. And when you go to your doctor's appointment, you'll already be ready with your copay or your co-insurance that you have to pay. So you can avoid having to get a bill altogether. So just thought I would, drop this video today to just kind of give you an idea of what to expect, because I get this call all the time talking to clients. Oh, well, why did I receive this bill? And many times it's just an explanation of benefits and not necessarily an actual bill. But just to know some of the behind the scenes things to look for, and then what to do if you receive a bill and you notice that it's actually not a real bill that you have to pay. So um, if you had any experience with this, leave your comments below. As always, if you have any questions, I love answering questions. So if you have a question about this, leave that in the comments as well. You always want to call your insurance provider, or you can go online if you need copies of this information. They will go ahead and send it to you, but you do have to request it. So it's not something that you actually will get with your welcome kit or your member ID cards in the mail. But just be aware that anytime you get a bill, you have the option to check that bill and make sure that it is an actual bill and not an explanation of benefits. So I hope that was helpful to you all today. If you have any questions or concerns, go ahead and put them in the comments. But in the meantime, have a great rest of your day, and thanks for spending some time with me. Bye bye.